Good evening, good evening. Welcome to another episode of a special broadcast of Urban Health Outreach Media. I am your host, Steve Belcher. Thanks for joining us this evening. I hope some of y'all got an opportunity to listen to my radio show today at www.wolbbaltimore.com, Urban Health Urban Health Radio, Urban Health Talk Radio. We had a great topic this morning, which we talked about assisted living facilities here in Maryland. They're becoming more and more popular. A lot of people are starting to open up assisted living homes, so we shedded light on it. Today, we have a great show. This kidney warrior, an individual I've been wanting to interview for a long time, but I finally got an opportunity to reach out to her to bring on the show. Amazing woman. She has an incredible story. I want to let her tell you. Recently celebrated 2-year kidney transplant in July, all the way from Kansas City, Kansas, by way of Tupelo, Mississippi. I don't know how you get from Mississippi to Kansas, but we're going to find out. But without further ado, Katisha Ray Anderson. Hey, Katisha, what's going on?
Hey, Steve, how are you?
Pretty good, pretty good. How about yourself?
I'm doing great, thank you.
You're awesome. How's the weather in Kansas?
It's a little cool here today, but nice weather, nice fall weather, nothing too bad.
Do y'all get a lot of snow there?
We do, yes, we get a lot of snow here.
Yeah.
Yeah.
Hey, Lawrence, thanks for tuning in from the UK. But yeah, so Katisha, 2-year kidney transplant. How many years were you on dialysis?
Well, actually, I've done dialysis twice. I was diagnosed with lupus nephritis when I was 14 years old, and
Sure.
I did dialysis 3 years after my diagnosis, and I regained some kidney function after that 3 years. I
Awesome.
regained
Wait a
kidney
minute.
function.
After I didn't mean to interrupt you. Wait a minute, because you're saying you did dialysis for 3 years
hmm
and then you regained kidney function.
I regained kidney function for a little bit over 22 years, and I went back on dialysis in 2015.
Wow. I mean, have you ever heard of that? Someone doing dialysis for 3 years, regaining kidney function, and then holding on for 22 years. I never heard of that. And in fact, what you do here is that if someone has some kidney function left and they start dialysis, that the dialysis kind of take that kidney function away. But
hmm
your case seems a lot different.
Yes, yes. My doctors say that that's kind of a miracle that happened. It just really doesn't happen very often. So, yeah, I was able to stay off dialysis for a little bit over 22 years. And at that 22-year mark, my doctor told me that my creatinine level was starting to creep up a little bit and that I was looking to be on dialysis again for a second time. So I just kind of wanted to be proactive and just go ahead and start dialysis because I knew that it was in my near future. So that's when I started again in 2015.
Wow.
Yeah.
That so man, this is a lot. Hold on. So I've heard of patients that had what they call acute kidney injury,
hmm
and they may not knew, and they started dialysis, and they may have done it for maybe several months
hmm
until their regain function.
Yeah.
Doing 24-hour creatinine clearance.
hmm
Now, when you first got diagnosed and you started dialysis,
hmm
did the doctor say that you were in a acute episode, or they thought you were at the end stage?
I was at end stage renal disease.
And
And
they did a biopsy and all that?
Yes, I had a biopsy, and my creatinine at the time was 4.6 when I was first diagnosed with end-stage renal disease. So I was in kidney failure. Yeah.
Wow.
Hmm.
So, excuse me, how do you view this? You did 3 years, so you had a taste of
Hmm.
3 years of dialysis, and then 20 something, 22 years just
Hmm.
about not being on dialysis and then getting back on and getting a transplant. How do you look at that? I mean, do you look at it as a miracle or your faith in God or just a coincidence?
I think it's a miracle. Um, I can't explain it any other way because you go from kidneys not working to working. That's something supernatural, and that's something that I can't explain. That's something that the doctors can't even explain, but it did happen.
Okay, so can you kind of take us back
Hmm.
um, when you found out that you would no longer have to do dialysis? Were you doing a series of 24-hour urine collections and blood work kind of leading up to that because you saw blood work that indicated that some residual function was coming back?
Well, at the time, I started out doing hemodialysis, and then I started doing peritoneal dialysis at home. And I was going back and forth to the doctor and doing all the lab work and all that stuff that needs to be done. And so one day when I was at school, my doctor called the school and said, "I need you to give me a call when you're out of school." And so that's when they told me that I didn't need to do dialysis anymore, that my kidneys had regained enough function that I didn't have to do dialysis again.
Hmm.
So I didn't gain 100% function, but I gained enough function that I didn't need dialysis. So there was still some kidney function loss, but it was enough that I didn't need the
You
dialysis.
didn't, right? You were maybe in one of the like maybe like stage 3 or something like that.
2 or 3, something like that. Yeah.
Hmm. Wow. So did you know what was going on at the time that
Mhm.
your kidneys were kind of slowly coming back to awake?
Well, no, I didn't realize it at the time until I got that phone call saying that you don't need dialysis anymore. I was just going about life doing dialysis and never knew that I had regained kidney function.
Hmm.
Yeah, I
So
didn't know.
when they called you and told you that, what was your first reaction? I mean, you couldn't believe it. I mean, what?
Could not believe it. Could not believe it. And I was a teenager at the time, so life was already hard being a teenager and being on dialysis. And then you tell me I don't need it anymore. Although I was still sick from the lupus that I had, taking away that element of having to do dialysis every day freed up some space in my life so that I could be a teenager and I could go to school and that type of thing. So I was very excited about it.
Mm.
Very excited.
So at what age did you actually start?
14.
You start, oh, okay. Wow. Did you
Yeah.
start in the pediatric clinic?
I did not. I went to the clinic at the hospital.
Hmm.
And so at the time doing hemodialysis, I just found that that wasn't practical for my life. Going to school, missing all these days, it wasn't working. So my mom and I, we did training to do the peritoneal dialysis at home.
Oh, awesome. So we have a question for you from Lawrence Hurst. He's out of the UK. Again, thanks, Lawrence, for tuning in. Really appreciate you watching the show all the way from the UK because you could be doing other things than watching the show. So thank you. But Lawrence, he asked, did your meds change during that time of regaining of kidney function?
Yes, some of my meds did change, like my blood pressure meds. I didn't really need as many medications for my blood pressure once I regained kidney function. The other medications that I were taking were pretty much to control the symptoms of lupus. So the blood pressure medicines are the main ones that changed.
Hmm. Now, so at 14 years old, you found out you had lupus.
Mhm.
Did you or your family know what you were dealing with at the time when you were diagnosed?
We did not. We didn't know anything about lupus. had never heard of it. Nobody in my family had lupus. And I can remember I was always searching for information about lupus. If I found an article in the paper about lupus, I was always keeping it because I was just so curious as to what lupus was, because at the time there was not a whole lot of information out there about lupus. So we went into this blind, not knowing what was going on.
Wow. And so now when you get a transplant,
Hmm.
do does the lupus go into remission, or how does that work? And do you still worry about that with your transplant today?
No, once I received the kidney transplant, I went to go see my rheumatologist, and he told me that having the kidney transplant actually put my lupus into remission, and I don't need to see him unless I start having symptoms again of the lupus. So
Hmm.
I don't really, I'm conscious that I could have those same problems again, but I don't walk around worrying about,
Sure.
lupus flaring up.
Now, did your rheumatologist explain to you, because I know you have, education behind your belt, but did they explain to you what can cause the lupus to come out of remission or flare-ups? Did they give you alternative ways to kind of keep that at bay, or do you know ways to not have that flare up?
Yeah, pretty much with the lupus, avoiding the sun. I make sure that I take all my medications, I get rest,
Mm,
that type of things. The general lupus things that you do to protect yourself from a flare. So
right.
that's what I do. Yeah, I just try to take care of myself. And if I have a symptom, I try to address the symptom. And so that's how I go about controlling the lupus.
Wow.
Yeah.
So I'm just going to say this. Just by looking
Mhm.
at you and seeing all your pictures on Facebook,
Mhm.
I wouldn't have never thought that you had a kidney transplant. Do you hear that a lot?
I I hear that a lot. Yes. I hear that a lot. Yeah.
Because I guess, and I guess there's no particular profile, but you see a lot of people with kidney transplants who may, um, have some of the symptoms
Mhm.
from the medication, as far as puffy face from the steroids, or gain extra weight or something like that. Has that happened with you and you just kind of shedded that weight, or you've been this size before the transplant and after?
Well, before transplant, I was 20 pounds smaller. I'm taking the steroids now, so I've gained some weight. And really, that's the only visible thing that I've noticed with the transplant meds. Other than the weight, nothing else, no. I've done really well since my transplant. I've not been hospitalized. I haven't had any complications. No side effects really from the medications other than the regular side effects that you would see from the anti-rejection meds, but I've done
Mhm.
really well. Yeah, I've done really well.
Absolutely. Now, I'm sure you participate in a lot of Facebook groups.
Yeah.
Um, when you see um, when you see posts of other kidney patients who had transplant, who may
Mhm.
be discussing some of the negative effects from their transplant,
Mhm.
and they're having more bad reactions than good. Um,
Mhm.
d- do you think about, like, compare your situation to that, or wonder if that's going to happen to you or anything like that, or
Mhm.
how do you uh, respond when you see comments of other people who's dealing with the same disease and had a transplant, but it's not, working as best for them?
Yeah. Well, for me, I realized that I could have had a total different set of outcomes than the ones that I have. I've had a very positive experience with my transplant. And for those who have not, I just tell them just do what you have to do to take care of yourself. Um, Really, that's all you can do. You know, every transplant is not gonna be smooth like mine. If
Hmm.
you have complications, just do what you have to do to get past those complications. For me, what I do is I do a lot of hand washing. When the cold and flu season comes around, you'll see me with my mask on. For me, I didn't let my guard down just because I was 1 month out or 3 months out or a year out. Even now, at 2 years out, I'm still very careful. If I go into a hospital because sick people are at the hospital, I'll have a
Hmm.
mask. Once I leave, I'm washing my hands, using my hand sanitizer. I just don't let my guard down because I know that I'm still at risk. And just because I'm doing well now doesn't mean that I'll always do well. So I
Hmm.
just protect myself. And for those who are having complications, just try to do the best that you can to get past those complications.
Absolutely. Okay, so 22 years later,
Hmm.
you are told again that you had to start dialysis.
Hmm.
Now, how long were you on dialysis the second time before you received the transplant?
I was on dialysis the second time for a year and a half.
Year and a half. Mm.
And when they called me and told me that I needed to be on dialysis again or that I was working toward needing to be on it again, I was devastated. I was devastated
Mm.
because I knew in the back of my mind that it could happen, but I didn't think it would happen to me, you know. So after I got past all the crying and all the being upset, I said, that's not going to help anything. I have to do what I have to do, center my life around the dialysis. Life is not over with because I have to do dialysis again. I still traveled. My son was in the high school band and they went from state to state. I would pack up my dialysis machine, have my supplies sent there, and I didn't let dialysis stop me. I still had a full-time job. I did my treatments every night for 8 hours at night, and I didn't let it stop me.
So when you started the second time, you had started off back at doing home dialysis.
Yes.
Um,
Yes.
was there in between where you had to do in-center before starting home dialysis?
No, because I started before I actually needed to do dialysis. I was able to get the catheter in, let it have time to mature, do all my training, and then I started dialysis again.
Oh, that's awesome. Now, speaking of that,
Hmm.
do you, I don't see that a lot of people who may be in the stage, say like stage 4 or 5, where
Hmm.
dialysis may be inevitable. But by you, like you said, you started everything before you needed to start,
Right.
where a lot of people get caught off guard and have to
Mm.
go straight into in-center do hemo. Do you think there's um, a lot of education for patients who may be newly diagnosed with kidney disease that may be at the stage 4 and stage 5 where they could possibly uh, do a preemptive transplant, get on the transplant list, or kind of get things together before this actually falls down on them?
I think a lot of times doctors don't do a good job at preparing patients for the inevitable. And telling them what their choices are. I'm fortunate that I have a very, very good nephrologist. I've been with him for years. And so he knows that I'm very proactive in my health. And so he walked me step by step. This is what's happening with you. So I was prepared for it. So I knew what I wanted to do if and when that time came. So I had a very good team.
Wow. So when I noticed that you do work with the National Kidney Foundation,
Mhm.
how did that come about?
I just walked into the office one day and said I want to be involved. So just walked in.
And how long you been working with them?
I started working with them after I received my transplant.
hmm
Yeah.
Wow. Now, okay, so can you take us back to when you got the call for your
Mhm.
transplant? Where were you at? What were you doing, and how did you find out?
Well, I was at home in bed, and it was about 9 or 10 o'clock at night, and my coordinator called me and said, "We have a possible kidney for you, but you're number three in line. There's two other people ahead of you. Number one only needs a kidney. Number two needs a kidney and a pancreas, so they will be bumped up before me as far as if they qualified for this transplant, and I was number three. So they called me, and my husband was out of town at the time. He was 4 hours away in St. Louis. So my emotions were all over the place. I was excited about receiving the kidney, but it was a bit overwhelming as well. It was the call that you wait for, but then when you get it, your reactions are totally different than what you thought they would be. My emotions were
hmm
all over the place. Yeah.
Yeah, I heard several people say the same thing.
Yeah.
Say the same thing that you just said. So, when did you find out that it was going to be that kidney was going to be for you, and it bypassed the other two people?
Well, I had to go to the hospital that morning, maybe about 8 o'clock, 9 o'clock in the morning. And so, they prep you for surgery as if you're going to have the transplant. So they actually had to go into the donor to check out the kidney and the kidneys and the pancreas. And once they looked at the kidneys and the pancreas was no good for the person that was number two. So that
Oh
bumped,
man.
yeah, so that I could have the transplant. Yeah.
Wow.
Yeah.
Wow. So you had the transplant. Were you nervous?
Oh, yes, I was nervous. I was excited, but then I thought about the donor's family, and that took away a lot of excitement for me because, I knew what they were dealing with. So, yeah. But I was
hmm
excited, though. I was happy that someone made the choice to give at the most difficult time in life. Yeah.
hmm
I
Were
was.
you able to meet the donor's family?
No, actually, I've written several letters to my donor's mom. And about a year and a half after my transplant, I did receive a 4-page letter from her. We've never met. I did receive just that one letter, but I've written her several times.
hmm
But
And where was the donor from?
the donor was a local donor. I don't know exactly where. I was just told local and
Okay.
young. Yeah, so whatever local means.
hmm hmm
Yeah.
Now, do you take a lot of medication now because of the transplant?
I do. I take some blood pressure medicines, and I take the anti-rejection meds. I am currently on prednisone, hoping to be weaned off of that pretty soon because I absolutely hate it. But I do take a lot of
Mhm.
medications.
Why do you hate the prednisone?
The obvious, the moon phase, all the weight gain. I'm always eating, never
hmm
satisfied when I eat something. I just don't like the prednisone.
Right,
Yeah.
right. Now, what working with the Kidney Foundation, how
Mhm.
has that been for you?
I really enjoyed working with the Kidney Foundation. I've had an opportunity to go to the state capitol to talk to legislators. I've sat on panels and talked about my transplant, talked about being on dialysis, the kidney walk. I've mentored patients. So it's been a great experience.
hmm So
Yeah.
let's get back to when you just said you mentor patients. Is that
hmm
through their peer program?
Yes. Yes.
hmm
And then, just through social media as well, I'll reach out to people that way and mentor people that way, or people that I just meet on the street or when I'm out and about, I'll mentor that way as well.
hmm Do
Yeah.
you visit dialysis units?
I don't really visit dialysis units. I do make bags during the holiday time and take them to the patients. But as far as going and actually talking to the patients, I have not had an opportunity to do that.
Hmm.
Yeah.
Hmm. So I know, you watch several of our shows, and I'm sure you may have heard us talking about different situations that may occur in the dialysis facility.
Yes.
Now, when you started back dialysis for that year that you were on, did you by chance see anything that concerned you in the dialysis unit among the staff?
You
Just, I
know,
mean, any concerns like hand washing or staff shortages or anything like that?
Steve, I had a really, really good team. My team knew that I didn't play. When you come into my room, the first thing I need you to do is wash your hands. And I don't mind telling a person, I need you to wash your hands. If they didn't wash them, I need you to wash them. When you're changing my catheter, I need you to have a mask on. I'm very active in my care. But at my dialysis clinic, I can say that I received top notch care. My nephrologist was excellent. The nursing staff was excellent. I have no complaints.
That's awesome. I mean,
Yeah.
that's awesome. And you did most of your treatment in Kansas or in Mississippi?
As a teenager, I did all my treatments in Mississippi. This second time on dialysis, I did all my treatments in Kansas City.
Mm-hmm.
Yeah.
Mm-hmm.
And there's some dialysis clinics that are around me, but I don't feel like those patients, based on what I've seen, are receiving top-notch care that I require for myself. So I decided to drive further out to get the care that I want.
Wow.
Yeah.
So you saying you had facilities around you, but you prefer to drive further where the quality of care was much better than the facilities that were near you.
Absolutely. Yeah,
Wow.
absolutely.
How far was it? I mean, did you have to drive?
Well, I live in Kansas City, Kansas, and my dialysis clinic was in Kansas City, Missouri. So just across the water, but I chose to drive a little further out to get the care that I require for myself.
Wow.
Yeah.
Wow. Now, before you went back on dialysis, that whole 22-year
Hmm.
span, did you like forget about dialysis, meaning it was like a passing thought, you just went on with your life?
Yeah. I went on about my life. I knew that it was a possibility that I could be on dialysis again, but in my mind, I didn't advocate for anybody that was on dialysis. I just dialysis was just something that was in my past, but I knew that it was something that could be in my future as well.
Hmm. Hmm.
Yeah.
Now, oh, I lost my train of thought. But when um so during that 22 years,
Hmm.
did you notice the I guess the tide of change with kidney disease, like start seeing more units popping
Hmm.
up and the prevalence of kidney disease? Did you notice any of that during the 22 years?
Well, I noticed that a lot of dialysis clinics are starting to pop up in my area. And I knew that a lot of people around me were starting to be on dialysis. But really, that's just the scope of what I saw. I really didn't pay a whole lot of attention because, you really don't care about something until you're in the radar with it. So, yeah, really,
Right.
that's the only thing that I noticed. Yeah.
And so at what point, I know after the kidney transplant, but at what point did you decide in your mind that you were going to advocate for this disease? Because you have people who get a transplant and just want to continue on with their life, and that's rightfully so.
Mhm.
But what made you want to um, stay connected to make sure your message got out there?
Well, for me, I don't want to forget about my friends that still need transplants. So I decided early on, even when I was on dialysis and advocating for myself, that I would continue to advocate for others as well. I don't want to ever forget where I came from and the need that I had for a kidney. So that's why I still advocate for those who are looking for living donors. Can't
Hmm.
forget people.
Hmm. So, so when you, I guess, met your husband,
Hmm.
did you have, did you were doing in that 22-year period of not having, of dealing with dialysis.
Hmm.
So when that reemerged back in your life, uh, did it take your husband by surprise, or you already warned him before that happened?
Yeah, we had been married for some years before I started dialysis again, and he already knew about my health issues. We've already been down several roads with me being sick with the lupus. So when I started dialysis again, he just kind of jumped on the bandwagon with me, and we said, we're going to do this. We're going to do what we have to do to get me through dialysis, transplant, and I cannot ask for a more supportive person. He will support me through anything. So, yeah, we just decided we were just going to do what we had to do.
That's awesome. That's
Yeah.
awesome. I'm a mentor for uh, American Kidney Foundation, that you may see other people dealing with this disease that don't have that type of support. Are you there, Katisha?
Yes, could you repeat what you said?
Yeah, we getting some frozen activity here. Um, what I had said was, and I almost forgot what I said, but I I lost my train of thought because I'm watching the screen and how it was slowing down, and I thought you were frozen because you was solid still. But oh, what I was mentioning about other kidney patients who don't have that support, um,
Mm-hmm.
you know, like you did from your husband, and um, how could, oh, that's what I was mentioning about that peer support. Do you see a lot of people through that program who don't have the support like you have?
I have not seen a lot of people come through without a support system. Honestly, I have not. But for those who don't have support, what I would say is try to maintain a positive attitude. I know that that's really hard when you're going through dialysis and kidney disease and being sick and not feeling well. But just know that you're going to have some good days and you're going to have some bad days. But a positive attitude makes a world of difference. Makes a world of difference. So if you don't have that support system, just try to be as positive as you can. Do whatever you can to take care of yourself. Find things that you like to do and reach out to people that you think may support you. You just never know. Sometimes people want to support you, but they don't know how to support you. They don't really know what to say. So reach out to those people that you think may support you. You'd be surprised. I've been blessed that I have a really, really good support system. Not just my husband, but I have great family. I have great friends. So, I mean, you just never know who's willing to support you,
Mhm.
but a lot of people just don't know what to say. They don't know what they can do to support you. So, if you just have a conversation, you'd be surprised who's willing to support you.
Absolutely. So that being said, what could people do to help people with kidney disease are going through this,
Hmm.
what could people do to help support them?
You can just be there. If they're feeling sick, maybe they need you to run to the store for them, or maybe go pick up their meds for them, cook for them, take out the dog for them. Just ask that person what they need. And sometimes just a listening ear, that means so much to a person that's sick. If you're just willing to listen without interrupting, that means a lot.
Mm,
Yeah.
mm. I mean, wow, that was powerful what you just said. Listen without interrupting.
Hmm. Yeah, because
Wow.
sometimes a patient has something that they're dealing with, and that's hard, dealing with sickness, being on dialysis. And so sometimes if you just listen, that could make a world of difference for somebody, because some people don't have a person that they can go talk to. I can pick up the phone at any given time. I can call my husband, I can call family, I can call friends. Everybody doesn't have that. So if you just take the time to listen, and even medical staff, if they would just learn to listen to their patients, that makes a world of difference as well. Doctors, listen to your patients.
Absolutely. I have another question for you from Lawrence. He wanted
Okay.
to know, did you have any matches in your family or friends that offered or no one did?
Well, I have a cousin that lives in Mississippi. He was willing to be tested and was actually tested and was not a match. I have a friend here in Kansas City. She went through the initial questionnaire portion of it, but because she has high blood pressure, she was not able to go forth with the testing. But other than that, my friend and my cousin back home in Mississippi, those were the only two people that stepped up to be tested.
Hmm.
Yeah.
Was there a time where you thought that it was going to take a minute for you to get a transplant? Did you ever have those doubts that, because you hear some people saying, I've been on the list for 5, 6, 8, 9 years, and you may see something on social media, and you're dealing with the disease, and because someone's saying they've been on the wait list for a long period of time, then one may think they may
Yeah.
fall in that category. Was there ever a time that you thought about that or had that type of thinking?
I did, but again, I just tried to take it day by day. I knew that it could be a year, it could be 5 years.
Hmm.
I'm sure nobody knows, but I knew that I could wait a long time. I knew that.
Hmm. Now, how important has your faith been in this whole process?
My faith has brought me through every moment with this disease. I started out day one and I said, okay, I can't control what happens to me with this disease, but whatever I go through, I want God to get the glory through whatever I go through. I want people to know that this is not Corticia. I've done really well with my disease, but this is not me. Had it not been for my higher power that I believe in, I wouldn't be doing as well as I am now. And for those who, have a faith in a higher power, just because you're going through and things are not going the way that you want them to go, that doesn't mean that you're not loved or you're not special. It just means that it's not your time. It's not your time.
Mm.
When it's time for your transplant, you'll have the perfect match, and that's all that matters. Positive attitude makes a difference.
I'm sure, and that's not just with kidney disease. That's with any um,
Yes.
adversity one may be facing, um,
Yes.
going through a season, as they call it.
Mhm. Mhm.
Wow. Now, do you have any siblings?
I do. I have one sibling. She's 7 years younger than I am.
Mm-hmm. Mm-hmm.
Yeah. And he's
Wow.
helped.
Wow. So what um well, let me ask you this. What type of work do you do?
I'm a school bus driver.
Oh,
And then
okay.
Yeah, I'm a school bus driver, and I just recently started with a local nonprofit organization where I go into the classroom and talk to high school students about organ donation. And we also mentor people that are on a transplant journey.
Oh, that's awesome. And you know what, Katisha?
Yeah.
I knew we had something in common. I used to drive a school bus.
Oh, cool. Okay.
Yeah, and look, in Austin, Texas, back
Oh,
in 1985, I was
oh, wow.
like 21 years old and drove a school bus for a short period of time, maybe 4 months or something like that. But
Okay.
it was interesting. It was very, very
Okay.
interesting. But yeah, you got to check the bus out before pulling off the lot, make sure everything is in working condition, and
Right.
that's awesome. So you have an opportunity to make a difference in young people's life working through this nonprofit and talking about organ donation.
Yes. Yes.
Wow.
Yeah. So what we do is we educate the students about what organ donation is and what it means, so that when they get their driver's license and they ask you, "Do you want to be a donor?" they're more informed on what that question really means. And so
Hmm.
we let them know that there's no wrong or right answer, but we're going to give you the tools and the information that you need so that when you're asked that question, you know what it means.
Wow.
So yeah.
Wow. So have you ever spoken at a school and had a student come up to you afterwards and said that they were going to donate because of hearing your story or you talking?
Yeah, well, they haven't come to me necessarily, but you hear them talking and they hear our stories on how our lives have been changed through organ donation, and they make that decision, I want to be a donor. So it's never, I've never regretted being able to share my story with people, because you just never know whose life might be touched or changed by you sharing. So I'm always willing to
Oh,
share. So it's
absolutely.
always great when you hear a young person say, "Yes, I want to be a donor." It's always great.
Hmm. Hmm. So during this whole journey dealing with kidney disease, what has been the biggest challenge for you?
I would say the biggest challenge has been, hmm, I think, I don't know, I hadn't thought about that. I don't know. I just kind of work my life around the dialysis and the sickness. I don't know what would be the biggest challenge, Steve. I don't know.
Mhm. So let
Because
me
we,
ask you this.
uh-huh.
During that year that you started back on dialysis, you did peritoneal.
Yes.
Did you ever experience any peritonitis?
Nope. No peritonitis. Always good hand washing. I had zero complications. And I know
Wow.
that's like something is wrong. Something is just too perfect. But I just did what I had to do to take care of myself.
No, but you know what, Katisha, that doesn't sound out of line because if you do what you're supposed to do, because dialysis is supposed to make you feel better.
Hmm.
So if one does what they're supposed to do, you're ingesting the right foods,
Hmm.
you're not fluid overload, you're managing your fluid, you're doing your
Hmm.
treatment when you're supposed to, you're managing your blood pressure. And if you're doing everything that research says or evidence base says to do, so you'll feel, you know, in a good state, then
Hmm.
uh, then that means it really shouldn't be any hiccups. I mean, but I know that doesn't work for everybody. But if you're being mindful of your health and again doing everything that you need to do, then
Yeah.
I guess one shouldn't
Yeah.
experience a lot of problems.
Yeah.
Lawrence wanted to know, do you, because of, I guess he would ask this maybe because of the medication, do you experience any emotional moods from the prednisone?
Oh yeah. Ask my husband. Yeah. Sometimes my emotions are kind of like all over the place, mood swings, and that's pretty common with the lupus as well. So yeah, I do experience some side effects from some of the medications.
Mhm.
Yeah.
Now, can you tell when these things are starting to kind of exacerbate, like your moods or emotional state, to where you could kind of like head it off and kind of prevent it from happening, or it just come out of nowhere and you like, where did that come from?
Yes, it comes out of nowhere. Most of the time, I don't even know when those mood swings will come. It just kind of comes out of nowhere. Yeah. And
Right.
I don't have those all the time, I don't think. I mean, you can ask my husband, he'd be able to tell you, but I don't think I have mood swings a lot. Now, he may
Sure.
say something different. Yeah.
Hmm.
Yeah.
Now,
But I do
oh
okay.
no, go ahead. I'm sorry.
I was just saying, I do okay.
Hmm.
Yeah.
What would you, what could you say to ladies and men, because not just ladies deal with lupus, but men as well.
Mhm.
Um, what could you say to people who may think they may have it, or want to know if they do have it? What, by you experiencing it at 14 years of age, what could
Mhm.
you say now as an adult for individuals that may be at risk for lupus?
Well, the diagnosis for lupus doesn't always come really quick. There's no one single test that you can take and it says, oh, yeah, you have lupus. What I recommend is keeping a journal of your symptoms and showing that to each doctor that you go to. And sometimes those symptoms with your lab work, put all that together, can give you a diagnosis of lupus. It just doesn't happen real quick sometimes. For me, fortunately, once I first started having symptoms, I went to the hospital. My doctor at the time contacted the Mayo Clinic. I'm not sure which one, but contacted the Mayo Clinic and they did a series of tests. And I got a diagnosis of lupus pretty quickly. I would say maybe within a week after I was admitted to the hospital, they told me that I had lupus and you need to start dialysis now. So
Mm.
yeah, I would just say keep track of your symptoms. Show that to each of the doctors that you go to. And you need to make sure that your doctors are communicating with each other. If you have a doctor over here and a doctor over there, they may not know what the other one knows. So you need to make sure that they're communicating with each other, and that helps as well.
Wow.
Hmm.
Wow. So let me understand this. So at 14, you diagnosed with lupus. So
Hmm.
up until that time, have you had any type of symptoms or anything that you could look back to say, wait a minute, because at the time, like you said, you got diagnosed at 14, and then you said by that time your kidneys were gone. So evidently it had to have been kind of like working on your kidneys for a period of time.
Yeah, I noticed from a very young age that I would always be tireder a lot quicker than my peers would be. And I noticed that I wouldn't always feel very well. Right before I received my diagnosis, I remember I had a really bad earache and I just felt really, really fatigued. So those are the things that I noticed. And then my mom, she told me early on in life, she noticed that I just wasn't as active and full of energy like my peers were. So
Mm,
those are things that we noticed early on.
right. You got several comments. Miss Donna Tissot mentioned, it said, Kertisha, you have a great attitude. And
Thank
then
you, Don.
and Lawrence asked again, he wanted to know what are the symptoms, I guess, of lupus.
Well, with lupus, the symptoms can vary. Because it's an autoimmune disease, your body can't distinguish between what's good and what's bad in the body. So it would just start attacking things. A few of the symptoms are fatigue, sensitivity to the sun, things like that. But you can just have a variety of symptoms.
Oh yeah,
There's no,
they can mimic other conditions as well.
yeah. Yeah.
So that's
So,
I guess that's why it's hard to kind of diagnose it because it can, the symptoms mimic other illnesses.
yes. Yeah.
Wow. Wow. So, Katisha, I mean, we're definitely coming down, and coming down to the wire, and I appreciate you, um, sharing your journey with us. But let me ask you, if people who are watching this, if they don't know anything else about you, what would you like them to know uh, about you and your kidney disease and what you do as an advocate?
What I want you to know is that a positive attitude makes a world of difference. No matter what you're going through, if you can maintain a positive attitude, you can get through this. Every day is not going to be easy. It's going to be hard. You're going to want to give up. Don't give up. This is not the end. You can still have a great life with kidney disease. That's what I
Mhm.
want you to do. And I want to say that people that your people around you, if they would just support you in this, you would do so much better with this disease than if you didn't have support. Support is so important. So important.
Mm. Mhm.
Yeah. So important.
Yeah, you're absolutely right with that because when I worked in dialysis, of course I wasn't doing these shows, but I never thought about the whole support
Mm-hmm.
situation, especially when you have people, and I've met many patients, older patients living by themselves,
Mm-hmm.
and and I'm wondering when we tell them to do this or do that, and they may, say, well, I don't have this or that. Now I can
Mm-hmm.
understand how having a support system can be so important, especially with people who depend on um, like these transportation services and don't have anyone if the transportation service don't pick them up and they miss
Mm-hmm.
dialysis, they can't get to dialysis, they just have to wait. And it's I just never seen anything like this with a disease that um a person go 3 days a week and other problems come out of this, and they
Mm-hmm.
still have to go through this. I mean, it just seems like, for instance, like with cancer, not taking anything away from that, but people go and they get chemotherapy for a period of time, then they stop, and then the cancer may be in remission or whatever the case is.
Mm-hmm.
But it's not like that for dialysis patients. It's you go 3 times a week until you get the transplant or until something happens where you're not here anymore.
Mm-hmm.
And something has to be done to you know something better has to be done, I feel,
Yeah.
to speed up transplants or other alternatives, or more
Mhm.
education to try to curb the high rates of diabetes and hypertension, which are the two leading causes of kidney failure. But we know there's other conditions out there that you may not can't um, prevent for
Right.
kidney disease to happen, but there has to be some education somewhere. Do you agree?
I totally agree, Steve. And I think our nephrologists need to do a better job at letting patients know their options. I think some patients would do really well with doing dialysis at home, but they don't know anything about it. They don't tell you that that's an option for you. They tell you you're going to go to the clinic 3 days a week and this is your only option. They don't tell you anything else. So I
Mm-hmm.
think you have to do a better job. And that's why I love what you do, Steve, because you're educating the community about kidney disease. And that's so important. I really appreciate that.
Thank you, Katisha. Thank you so much. I mean, I try to do what I can, but I really feel that, these larger organizations, meaning the dialysis organizations, I
Mhm.
think they should, I think they have a moral obligation to, at least, if you're going to put all these clinics in neighborhoods to
Mhm.
combat kidney disease, at least you should have some billboards up, saying diabetes and hypertension are the two leading causes of kidney failure, to give people a chance to see what's the major causes of this disease. It's almost just like with the cigarette and the tobacco industry.
Mhm.
Even though, cigarettes been linked to cancer, lung cancer stuff, they still sell them. But on the flip side of that, they had the Surgeon General's warning on the packet. And I feel
Mhm.
they could do that for cigarettes. They could do that for dialysis treatments.
I
Okay,
agree.
you can put them in there, but yet put out the education so we could give people an opportunity to seek um, um, preventive measures uh, to prevent that from happening.
I agree with you, Steve. I agree. I think a better job needs to be done in that area. I agree.
Absolutely. So as
Mhm.
we end the broadcast, do you have anyone you like to say hello to or shout outs?
I want to shout out my husband for always being supportive. I want to shout out all my friends and family for just being so supportive. I don't think I would be the person that I am if it was not for my support system. So thank you so much. It means the world to me. I don't take it for granted.
That's awesome. That's awesome. Now, one more thing I wanted to ask you, Katisha. Do you visit Mississippi often, or you go back?
I go back every now and then, maybe once or twice a year.
Hmm. Is
Yeah.
the kidney disease rates high down in Mississippi?
Steve, I really don't know. I don't
Hmm.
know because I
Right.
don't go visiting any of the clinics or any of that. So I really couldn't say yes or no on that because I don't know.
Well,
But
let me.
I'm sure it is.
Yeah, I was just going to tell you that's one of the states that, the southern states that have high rates of kidney disease as well.
Yeah.
Right.
Probably
Wow.
because of the foods that we eat there.
Hmm. High
Yeah.
sodium.
Mm-hmm.
And right. Wow. I know you
Yeah.
have some good food.
Oh yeah, we have good food
Right.
there.
Right. All right,
Yeah.
Katisha. Well, again, thank you for coming on, taking the time out of your schedule to share your kidney journey. Very, very interesting, especially uh, you doing dialysis for 3 years and finding out that you didn't have to do it no more, and you went on for 22 years before
Hmm.
this disease snuck back up on you. Wow.
Yeah. Yeah. I
Wow.
really
So,
been blessed, Steve. Been blessed.
absolutely. So, what's in the future for you?
More advocacy. Looking forward to my new job position with this local nonprofit organization. Just want to continue to share my story and educate people about kidney disease.
Absolutely. All right.
Mhm.
Well, Katisha, again, thank you for coming on the show. I have your number now, so I know how to contact you. I definitely want to bring you on a couple of other shows.
Okay.
We do Warriors Quest, and we always like to bring in co-hosts, individuals who had a kidney transplant to again share their their story and also give hope to the persons that's seeking a living donor.
All right, Steve. Thank you so much. I really appreciate you.
Thank you too, Katisha, and I look forward to again collaborating with you and talking with you online and um, through through phone.
All right, then. Thank you, Steve.
All right, Katisha, take care and have a good night.
You too. Bye.
All right, bye bye. Oh man, this was an awesome show. I really enjoyed Katisha Ray Anderson being on here. I thought it would be a long time before I would get her on, but I am so happy that we were able to share her story and journey right here on Urban Health Outreach Media. Stay tuned for Warriors Quest coming up next with Jared A. Brown. His guest is Karan Perswad. I may have messed this guy's name up, so I'm not going to try to pronounce it. But Jared has a great show coming up in about 15 minutes, so stand by and watch his show. His guest is coming all the way from Los Angeles, California. This is going to be a show you don't want to miss. It's been about 3 weeks in the making. So please stay tuned. Go get some popcorn, some drinks, water, whatever. Get ready to sit back and hear from Mr. Dynamite himself, Jared A. Brown, coming up in about 10 minutes, 12 minutes, 13 minutes right here on the Urban Health Outreach Media. And if you're watching this and you have a business and you want to advertise and get your word out, get information out, you can advertise right here as you see on the screen. We have it to the left, advertise your logo. You can also advertise at the bottom of the frame where you see it has the number. So if you have a business and you want to try to reach more people and you're thinking about marketing and advertising, please consider Urban Health Outreach Media. This is how our frame look, and you can see where your logo goes. So coming up, 13 minutes, Warriors Quest, Jared A. Brown. Thanks again for watching. Tune in tomorrow for a new episode of Urban Reno Talk with Tamika and Steve. And then on Friday, we got the amazing Jeff Hartley, who is a kidney donor and who manages Werner Needs a Kidney. So we got all this for you this week, starting tonight, 8:30, Warriors Quest, Jared A. Brown. Thanks for watching. Have a great evening and stay blessed and encouraged. Peace.